Morning, everyone. I'm Danny from SameView, and good morning from Sydney, Australia. Our mission is to bring teamwork into disability care for all families. I want to start by introducing you to my own family. So here are my children, and for my kids, my goals are pretty similar for all of them. I want them to be happy. I want them to get a great education, to have friends, to do activities. But things differ a little bit for my youngest son, Monty, who was born with a rare disease. Now, for him to achieve the same goals, I need the help of our team. And in Monty's team, we've got nearly 40 different people, medical professionals, allied health professionals, school teachers, support workers, family and friends. And what you need to know is that those people don't talk to each other. And so the stress and workload of coordinating this team falls on us as parents. To solve this problem, we've created SameView, which is an online platform for care coordination that helps families like mine to have every single person from their team working together, talking to each other to help the family to achieve what's important to them. Families can access SameView via any internet-connected device. There they can sign up, share their story just once, share what their goals are, include every person from their team, and what they get is a secure and private place for that team to communicate and collaborate. If you're a provider or a professional that has been invited into a family's team, what you get is a really fast and effective way to get updates about what is happening in that family's life in terms of at home, at school, and also with the other providers. This gives you the context you need to make decisions that are aligned with the rest of the team, and importantly, aligned to the goals of and aspirations of the family. All of the events are linked back to the person's goals, and so we make it really easy for outcomes reporting as well. A little bit about our progress. We mostly serve families across Australia and New Zealand at the moment, and we're proud to have reached 2,000 users across these countries at the moment. What's important behind that number, though, is that that community of families and professionals are working together towards over 2,500 goals. And what's even more important than that is that we can see within the SameView system, there's about 62,000 instances of engagement with people sharing information, reading information, commenting on information. And that is important to me because it represents the emails, the phone calls, the in-person or in-clinic conversations that you would normally have to have without the SameView platform, and also one-to-one as well outside of our platform. Our community is very diverse. We're supporting many children, but actually people of all ages now and across all different disabilities. We have a diverse range of providers and professionals using SameView. And again, what is most important is what they're all working towards. And as you can see, the goals that people are working towards are incredibly diverse as well. We provide SameView to families via a B2C business model, an annual subscription, and this works really well in Australia and New Zealand, where we're aligned with national disability insurance schemes. We're also aligned with our state-based accident insurance schemes. That being said, we do have a growing number of B2B arrangements with disability support organisations, and also disability providers here as well. We've got an experienced team, and in addition to being backed by StartUpHealth, we're also backed by the Cerebral Palsy Alliance, based here in Australia, which is one of the world's oldest disability support organisations. We're also really proud to be supported by a great number of different amazing organisations along the way as well. So what's next for us? We are working on supporting all families, so more diverse families in terms of culturally diverse and economically diverse families. We are looking at building and using the power of the community to support each other. We're working with more specific organisations, and of course, we're also deriving more value from the data that we're now building. We would love to work with you, and I'm excited to tell you today that we are releasing our first impact report. So if you're interested in what you've heard today, please go to our website and see the report. You'll hear in-depth stories from different families and providers in there as well. We're always looking for new partnerships to provide SameView to new markets, and look out for an upcoming seed round next year. Thank you so much for your time, and I look forward to hearing your questions.
Thank you, Danny. Thank you for sharing the little bit about your beautiful family also. Question that has come in right off the top. What features are different with SameView as available with so many other care collaboration platforms? So maybe where you fit on the competitive landscape.
I think where we are different is that we are one of the only ones that is truly been co-designed with families and providers. We're consumer-led, and we mirror a model where families can work with providers from all different organizations. We find that that's actually a huge barrier to a lot of systems for providers to be able to actually communicate with providers from other, say, competing organizations or even different sectors like education or government sectors as well. We're extremely lightweight and lean because we've been well co-designed. Only the features that have been asked for by families and users themselves are there.
That's great. That sounds very key in a platform like yours. You mentioned partnerships to expand SameView into new markets or countries. What kinds of partnerships would you be looking for? And maybe talk about your expansion plans for other markets.
Yeah, so as I mentioned, we mostly support families in Australia and New Zealand. That being said, we actually have users all across the world. So we would love any help and partnerships in expanding to new markets, particularly in different countries. And I guess what we bring is a solution that is tested, that is mature, that's been co-designed, like I said, with users in mind, something that's actually lean and efficient and provides the foundations for more or adaptation to the needs of that particular market. And so I guess the kind of organizations we would love to work with are ones where they may be trying to solve the challenge of bridging that gap between themselves and their consumer, and maybe with other providers that they work with, or with the education sector. And this could be charities that support particular disabilities, or providers that work in, say, children's health and children's early intervention services as well.
Thank you. I'm sure that your days are filled with a lot of gratifying stories and feedback from customers and families. Are there any moments that customers have shared with you that really stand out?
Yeah, so look, engaging with our families is by far my favorite thing and the most joyful thing I get to do every single day. I mentioned we're releasing our impact report today. And so you'll actually see this story within one of the reports. But one family that really stands out is a mum called Chelsea, who's an amazing advocate for her young daughter, who's just started going to kindy. Now Chelsea has complex needs, but she deserves the same education as every other child. So she started to attend kindy. Her kindy teachers aren't experienced in supporting a child with this particular disability. But through SameView, what they get is support from all of the clinicians that are on their team. And what we see is beautiful feedback going back and forth between the clinicians and the educators. And what that's creating is an incredibly inclusive environment for this young girl to receive, the same education as every other child.